Alright, so pharmacy medication errors that I have seen make it to the patient. First on my list, we had a benzo switch up. At the top, we have diazepam 5, and at the bottom, we have Klonopin 0.5. This was back about a year ago when we had one technician and one pharmacist working on a shift. Remember, I work at a 24-hour store in the city. Lines at pickup were like 13 people deep, 4 people at drop-off, 7 people in the drive-thru, 10, 11 pharmacy calls, everybody yelling about their stuff not being ready. On top of vaccines, transfers, voicemails, temp checks for the fridge, cycle counts, inventory stuff. Only one of the patients got the wrong med and they took it. It had the other person's label on it, so they brought it back to the pharmacy. That's how we figured it out. This is not a huge switch up because they're both long-acting benzodiazepines of similar potencies, but this could have been a big mistake if it were a different patient or a different drug. Next on my list, the patient received a bottle of Bactrim. This is an antibiotic. I usually see it for like a UTI or cellulitis. It can be used for some other things like PJP, nocardia, toxoplasmosis, and sometimes like listeria. The patient got a bottle of Bactrim instead of levetiracetam. They got multiple bottles, so at least one thing didn't look like the other. Levetiracetam or Keppra is used for seizure disorder. I believe that this was a pediatric patient, and then I don't believe that they took a dose of the Bactrim. Next on my list for medication errors that I've seen is a patient was prescribed pantoprazole, which is for acid or GERD or ulcers. They got a 90-day supply, and 2 of the 3 bottles was pantoprazole, and 1 of the 3 was raloxifene. Raloxifene is a selective estrogen receptor modulator. It's sometimes used with osteoporosis, and then also sometimes used as chemoprophylaxis with breast cancer. This is to prevent or decrease your risk of breast cancer in high-risk patients. Patient did not take it, but still not a good mix-up. FYI, raloxifene has a black box warning of DVT and PE, so it shouldn't be used in patients who have a history of blood clots. Another medication error that I've seen that has made it to the patient is a patient got a glaucoma eye drop instead of an antibiotic eye drop. This was not a good mix-up because the patient was also incarcerated, so they're using the glaucoma drop 4 times a day, when normally the glaucoma drop is daily and the antibiotic drop would have been 4 times a day, so his eye infection was not getting any better. It wasn't caught until about a week after this patient was using the eye drop. Next on my list, I've had a patient pick up their Xanax, and actually the pills in the bottle were actually famotidine. So famotidine is Pepcid. It's over the counter for heartburn. It's an H2RA or a histamine 2 receptor antagonist. And then we all know what Xanax is. It's an intermediate acting benzodiazepine. It's usually used for as-needed therapy for anxiety, but I do have a lot of patients that are on it chronically multiple times a day. Whether that's a good thing or not is a different discussion, but the patient didn't notice until like a week or 2 in of using the Pepcid as Xanax. I can't remember if this patient was on it chronically because it was so long ago, but I believe this patient was on it chronically, and if you don't know, benzo withdrawal is like intolerable. When you're coming off of a benzo, you have to do it very gradually and under medical supervision. With benzo withdrawal, you can have panic attacks, insomnia, confusion, hallucinations, tremors, sweating, at worst seizures. I thought that was a wild mix-up. I'm not exactly sure how that happened. Alright, so pharmacy medication errors that I've seen make it to the patient, part 2. I've seen a patient receive Percocet 10 milligrams instead of Hydro 5. This was not a good mix-up because this was for an acute pain patient. The daily morphine milliequivalence was 60 instead of 20. I've talked about morphine milliequivalence or MME on my page before, but it's a gauge of how much opioids someone is getting. At 50 MME, this is when you usually recommend Narcan to a patient, the opioid reversal agent. The patient did take the medication and was overly sedated, but luckily nothing else happened. Another random mix-up, a patient received someone else's meloxicam instead of Suboxone. That's kind of a wild mix-up. Meloxicam is usually used for like arthritis, it's an NSAID, and then Suboxone we know is for opioid use disorder. This patient did not take the meloxicam, they just brought it back to the pharmacy. Some other random medication errors that I see is fluoxetine 10 and 20 milligrams. Teva brand, they sometimes get mixed together in the robot. The robot needs to be loaded with drugs, so we take stock bottles of drugs and we scan it and we put it into the robot. But a robot or a script pro fills medications. It has a little arm that goes up to the cell and it counts out like 30 or 90 pills, and then it brings it over to this conveyor belt and labels it. The staff grabs the label from the robot and brings it to the production station. We scan the label that we put onto the bag, and then we're supposed to scan the vial. Some technicians scan the label that's on this label instead of the label that's on the vial that they grab. This is where a majority of medication errors, I think, come from. If you scan the wrong vial, it will tell you it's the wrong vial. But robots like this are at higher volume stores. We also put return to stock vials into the robot. So this is when you don't pick up your medicine after 2 weeks, we return it to stock, which is we label it into our system and then we put a custom label on it instead of dumping it like back into a stock bottle. So these medications out of the robot are usually ready-filled drugs. And those medications are sometimes medications that people are switching doses on or like not picking up as frequent as we're filling them. But sometimes these return to stock or RTS vials are not scanned when they're being put into the cells to fill the robot. At higher volume stores, we can have hundreds of return to stock vials just sitting on the shelf. It takes time to individually scan the labels when loading the robot. On the top we have fluoxetine 10, on the bottom we have fluoxetine 20. When they're all mixed together, it's hard to pick them out. A lot of pills in the pharmacy have the same coloring and shape, and they're kind of different just by the size of the pills. Another drug that sometimes gets mixed together in the robot are different strengths of atorvastatin, like 20 milligrams and 40 milligrams. Since we're talking about the robot, I've actually seen tramadol, which is an opioid, a C4 with SNRI activity, put in the cell instead of atorvastatin. So again, atorvastatin is for cholesterol. They're both kind of oblong white pills. Not a good mix-up, but I guess they're only going to be taking the tramadol atorvastatin daily. I will mention that I don't believe any patients received tramadol instead of atorvastatin. I think it was caught before it got to the patient. I just thought of another medication error that was kind of wild. But I had a patient that was on New Start to Trulicity, so the 0.75 milligrams weekly, and then they accidentally got someone else's Trulicity, which was the 1.5 Trulicity, so the next dose up, and then they administered it daily instead of weekly. He came back to the pharmacy and was mad, and was like, why did I only get 4 pens for this month? And I was like, sir, it's injected weekly. And then he just had this blank stare at me, and then we figured out it was also somebody else's medication. So he did the 1.5 Trulicity daily for 2 days instead of the 0.75 weekly. But long story short, don't rush the pharmacist, don't rush the pharmacy staff, check your labels, check your medicines, make sure you're getting the right medication in the right quantity. Alright, so medication errors that I've seen in the pharmacy. This is a PSA to stop rushing your pharmacists and technicians and to be patient when you're going to the pharmacy. Y'all know I like lists, so let's start with medication errors that I caught that did not make it to the patient. First on my list was a prescription for amantadine for a dog, which is sometimes used for pain. In humans, it used to be used for influenza A, but not anymore due to resistance, and then it's sometimes used for Parkinson's. I usually see it as an add-on to a dopamine agonist or Cinemet. It was entered and filled for amiodarone, which is a potassium, sodium, and calcium channel blocker. It's sometimes used for rate and or rhythm control in AFib, and it's generally not a first-line agent. This is not a good medication mix-up. This could have killed the patient. Next on my list, I had a prescription for medroxyprogesterone, 6 tablets daily for a few days. This is a progestin. It's sometimes used for heavy bleeding. The medication that made it into the bottle that was labeled as medroxyprogesterone was actually furosemide or Lasix. They're both little white pills, but of course they have different numbers on them. Lasix or furosemide is a loop diuretic. It's used sometimes in heart failure patients as needed for swelling or edema. This wouldn't have been a good mix-up either because the patient would have been taking 6 tablets of Lasix every day, thinking that it was medroxyprogesterone. So our main concern here would be electrolyte depletion, namely potassium. Next on my list, I had a patient who had a prescription for methimazole. This inhibits the synthesis of thyroid hormone. It's for hyperthyroidism. It was accidentally filled as Minidrin, which is an alpha-1 agonist. It's usually used for orthostatic hypotension, which is when your blood pressure drops when you stand up from sitting or laying down. Next on my list, we got a hard copy prescription for the drug Robinol, which is a brand name for glycopyrrolate, which is a muscarinic antagonist. In this case, I believe it was being used for hyperhidrosis or excessive sweating. It was misentered as ropinirole, which is a dopamine agonist for restless legs and Parkinson's. Their handwriting on this prescription was really bad, by the way. Didn't think a dermatologist would be prescribing ropinirole. Next on my list, I caught this one a couple weeks ago, but metronidazole 500 was entered as the 375 capsule, and it was for a different patient. So they had the same name, but different dates of birth. Not happened here, but I think somebody was rushing, and when you type Flagyl in the system, it only comes up with the 375. You have to type the generic metronidazole to get the 500 strength. But it was also verified wrong and just in the waiting bin waiting for pickup. I found out when I was looking at previously entered scripts when we couldn't find a prescription for a patient that just dropped off, the other day. Last on my list is I had a latanoprost prescription today entered under the wrong person. They had the same date of birth and similar names, but it was a totally different person. I can't stress how important it is to check your medications, check the labels that you're getting, and then also be patient when you go to the pharmacy. Medication errors can be dangerous, and a lot of 24-hour stores are improperly run. Corporations are not adequately staffing pharmacies. This is medication errors I've seen in the pharmacy part I don't even know at this point. A prescription was filled for sodium bicarbonate instead of prenatal tablets. This prescription was picked up and the patient did take them. If you've been following my page for a while, you know that a lot of these errors are because of how pharmacies are being run these days. Completely understaffed, overwhelmed, overworked. So if a store is filling 1,000+ scripts a day, a few errors are going to make it out. Another error I've seen is a prescription was entered for Keflex 500 instead of Keppra 500. So it was entered and verified and filled and picked up for an antibiotic instead of a seizure medication. The patient did not take this one, thankfully. They brought it back because it didn't look the same. If it was a first-time dose for that patient, how were they supposed to know what the tablets looked like? Another error I've seen was there were 3 medroxyprogesterone pills in a bottle of Lexapro. They're both little white pills. Don't know how they got mixed in, but the patient did not take them. I called on this one. Another error I've seen was one weekend we were incredibly understaffed because that's usually how it is. You have a pharmacist was doing a 12-hour shift with one technician in the morning and one in the evening. And it was in the evening and it was really busy. Two caregivers dropped off scripts at the same time. One dropped off a script for amoxicillin 400/5 and one dropped off a script for acetaminophen and ibuprofen, or Tylenol and ibuprofen. I'm sure y'all have seen SpongeBob, but this is what it's like in the pharmacy. So these prescriptions got entered and they got filled, and then when the caregivers came back to pick them up, the technician switched the people. She was running all over the place. She mixed up who was supposed to get what, and she didn't verify a date of birth. People are really pushy when they want their medications. They want it like now. So when you cut corners, mistakes happen. This was her first mistake, and it was really bad for her. She actually quit because of this. Another mistake that I see all the time is caregivers getting amoxicillin, like suspensions, without the water in it. Staff is running around too fast and they miss like reconstituting it. Sometimes only half the water gets in there. Some of the technicians are new to doing it and just forget to put in the second amount. So that doubles the concentration of the antibiotic. I've actually had a caregiver like give their child like dry scoop like amoxicillin. That's like crazy. I've been talking about this a lot lately, but like medication errors are not the only effects that we're gonna see with how pharmacies are being run these days. Pharmacists don't have time to call providers and clarify prescriptions. Sometimes they're just gonna flat out refuse prescriptions that they're not sure about because they don't have time to call the providers. There's so many issues with retail pharmacy that are preventable if they were just staffed. These are medication errors I've seen in the pharmacy, part 2. These are specifically ones that we caught before they made it to the patient. My last video was ones that actually made it to the patient. One error that I've seen is like a Keppra and a gabapentin switch. So a bottle of Keppra was labeled gabapentin and a bottle of gabapentin was labeled Keppra. So seizure medication, Keppra, and then gabapentin's usually used for like neuropathy or nerve pain. Another medication error I've seen is losartan labeled as a torvastatin. Losartan is a blood pressure medication. Torvastatin is for cholesterol. They are both daily though. Another medication error that we caught was Suboxone 8-2 is generic, the buprenorphine naloxone, is labeled as bupropion 300. So one is an opioid, a controlled substance schedule 3 for opioid use disorder, sometimes used for pain, labeled as bupropion, which is an NDRI or a norepinephrine dopamine reuptake inhibitor, and it also blocks cholinergic receptors. It's used usually for depression, sometimes for smoking cessation. Off label for ADHD, it's a weak stimulant. Another medication error that I've caught, this one was potassium 20 MEQs, extended release, were inside a bottle labeled 10, so it's double the dose. You gotta be careful with your potassium doses. Potassium is used for supplementation when your potassium levels are low or hypokalemia. We usually see this with patients on diuretics like Lasix. Another med error that I guess like we didn't really catch for a while, but we used to have controlled substances in our robot. This is Big Bertha. She will go and she'll scan the cell and she'll fill these pills and they have the patient label on them. So what we did was we had Ambien in the robot and I guess it was miscalibrated. So it was giving people like 10 extra Ambiens like per fill. Jackpot, because like the pill size was like not like adjusted properly. So we took the controlled substances out of the robot because of that.